shootings that have shaken Toronto's neighborhoods to their core. 3 people hit by bullets on Queen Street near Spadina on a busy Saturday evening on June 30th. 2 up-and-coming rap artists would later die of their injuries. 2 days later, more gun violence, sending 4 people to hospital with a range of injuries. A 19-year-old man would later die in that incident. Well, some of the most severely injured in each of those high-profile shootings sent right here to St. Michael's Hospital. Its ER and its staff feeling the pressure of Toronto's extraordinary spring and summer of gun violence.
Well, we've seen 33 gunshot wounds this year, heavily concentrated in the last 2 to 3 months. So we're seeing 2 to 3 a week over the last about 8 to 12 weeks. Well, we're a trauma center, and we're set up to handle victims of gunshot wounds and other major injuries. But when a patient like that comes in, time is of the essence, and we mobilize a large amount of people and equipment and resources in order to make as many diagnoses as we can in the early part of their treatment. And so that can be quite disruptive to the operation of the emergency department, because we have to stop what we're doing and go and attend to the trauma patient for anywhere from 5 minutes to up to an hour, depending on the circumstances.
St. Michael's is one of 2 trauma specialty hospitals in Toronto. It's located right in the city's downtown core. Dr. Bandera has been an emergency doctor for 20 years. He is now the chief of emergency services. He says where they might have seen a shooting victim every month is now closer to 1 a week, reminding him of the summer of the gun in 2005.
We've seen more victims this year than we have in the recent past. It feels very similar to about 10 years ago when we had a surge in gun violence in the city. So we certainly notice a difference when it happens. I think in this case it's also been concentrated in the last 2 to 3 months. So this surge, I think year over year the numbers don't look too dramatic, but we've certainly seen increased activity over the last couple of months. And it weighs heavily on the team because these patients do take an emotional as well as a professional toll on people.
And there have been 54 homicides in Toronto so far this year.